Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. In Season 4, our topic is healthcare data analytics as a career. I spoke with some folks who are new to the field or thinking about joining in. I also spoke with some seasoned professionals and learned from their insights and suggestions for those who are beginners. I hope you find these conversations as enjoyable and informative as I did. More importantly, I hope they help you in your journey. Today, I get to share with you my conversation with Kim Leak. Her inspiring journey from a direct support professional to a dedicated nurse highlights passion, determination, and the importance of mentorship. Along the way, an appreciation for the power of data analytics and its impact emerged within Kim. Her diverse healthcare experiences and academic achievements showcase resilience and commitment. Listen in to why she decided to further explore the impactful role of data analytics in improving care and outcomes in healthcare. If you could just give us a little introduction to Kim, who you are, like a little bit about your background and what you're passionate about, that would be great.
Hey, my name is Kim. I've been a registered nurse for over 4.5 years now. Actually been in healthcare for over a decade. I started off working as a direct support professional. And during that time, I had already had a bachelor's degree. During that time, I decided that I wanted to be a nurse. My sister-in-law is a nurse, so she definitely encouraged me. But she told me, you really should try to pivot to become a certified nursing assistant. So that's what I did. I was taking prerequisites for nursing just to have that bridge between both bachelor's degrees. So I was taking my prerequisites, I was working, I got my CNA certification, and I worked at the hospital for the first time in my life. And that was exciting, that was dynamic, definitely challenging. I worked on an oncology floor, so it was mixed, but it was specialized for oncology. The nurses were certified in chemotherapy. So a lot of the people had cancers, a lot of advanced cancers. There were some happy stories too, people being successfully treated and going into remission, but unfortunately we did have a lot of deaths too. So it was definitely eye-opening, and it gave me a glimpse into, what I would be dealing with as a nurse. This was a few years before COVID, maybe 2016, 2017, 2016 to 2018. I worked at Stony Brook.
Okay.
So then I applied to different accelerated Bachelor of Nursing programs for second degree students. I got into SUNY Downstate. And I say they're wonderful because it's very inexpensive. It's a great value for your money. Very inexpensive because it is State University of New York. It is a public school. And out of 80 of us, a class of 80 of us, 78 graduated.
Wow.
And then out of the 78 that graduated, I think like 74, 75, I don't know the percentages off the top of my head, but well over 90% passed the NCLEX, the board exam the first time. So those are the numbers that you definitely want to look at for anyone.
Yeah.
Those numbers
Success rate.
Yeah. So, definitely look at that. And if you can get into an in-state school, like I said, a lot of value for the money. So I did that. And then I graduated 2019, took my boards October 2019. I did work in a nursing home briefly, the end of 2019. And what's funny is that that's when COVID was starting to kick off. At the time, a lot of the residents had pneumonia.
Mm-hmm.
And this was a time, because it was so new, you had to be like elite to get a test, or really, really ill to get a test.
Yeah.
So they were not testing. We were not swabbing anyone. We didn't even really have it accessible, which is
Mm-hmm.
really kind of sad, looking back. But a lot of people were symptomatic. We were putting them on oxygen, and we weren't even donning masks at this point.
Mm.
Um, so I was there, wasn't the safest environment, especially for a new grad who has to learn the critical thinking skills and assessment skills and evaluation skills required. So I pivoted to the hospital in March of 2020. And I'll never forget the date, because it was Friday the 13th, Friday, March
Yeah.
13th, 2020. I always say the world shut down, like everything shut down.
Yeah.
So I
Yeah.
remember being in the classroom those first couple weeks, and they said, "Oh, this is just a little cold. It's just a little harmless flu." And then I got on the floor a couple weeks later and started, to really train on the floor with the nurses.
Mm-hmm.
And well, it was not that. It was, in fact, a lot more severe.
Yeah.
Yes, to be honest with you, I plan to stay in healthcare
Oh, yeah.
till for the
Totally.
rest of my life. And the thing that I love about healthcare and nursing is so many things you can do. It's so many things you can do. And I researched, do a little bit of research, with AI and machine learning, and it just gets so intricate and so sophisticated.
Mm-hmm.
So I'm definitely interested in, like you said, augmenting, taking the skills that
Yeah.
I've learned the past several years, and augmenting into, handling data, and
Mm-hmm.
using that data to improve patient outcomes.
Are you looking to continue like direct patient care, or shift to managing or working with data solely?
The tricky thing is, I'm not, I have to be honest, I do miss direct patient care.
Mm-hmm.
Even to the point, like, now I work in nursing administration as an infection preventionist. So that's leadership.
Mm-hmm.
But
Mm-hmm.
even I still find ways to be hands-on.
Mm-hmm.
I'll go up to a patient myself and assess them.
Okay.
I kind of feel like sometimes leadership is not as involved in patient care as they should be. That's across the board. Um, and it's important to me to still refresh on those assessment skills and those nursing skills that we've learned. Um, I think in leadership, you take those skills and you implement it on a broad level,
Mm-hmm.
throughout an organization to improve patient care.
Mm-hmm.
But yeah, I still like to get my hands dirty. I'll still try a shot at an IV. I'll still try to put a Foley catheter in.
Yeah.
Some of the new nurses, can't find the urethra.
Ooh, okay.
I still walk around with my stethoscope. I'll listen. I'll talk to the patient, and I'll call the doctor, and I'll
Yeah.
coordinate with them. So just finding a way to kind of take the skills that I've learned and
Mm-hmm.
honed, and see
Yeah.
how we can improve data is definitely important.
So tell me, what is it that you're looking to do in your career, and where do you see yourself in like 5 or 10 years?
I have already started looking at master's programs.
Okay.
Because I'm in infection prevention, I'm like, I could probably get into like a master's of public health program.
Mm-hmm.
But I'm looking definitely for either an informatics MPH with informatics concentration, or a master's of science in informatics.
Mm-hmm.
Um, Definitely looking into that sort of coursework.
Mm-hmm.
And I actually, we discussed earlier, I'm starting a new job, and I'll have a lot more time on my hands, and looking into things like SQL, Python, because I know that those are very popular
Yes.
um, in, in healthcare data, and
Yes.
also getting more comfortable with Excel.
Mm-hmm.
Definitely been using a lot of Excel in this role the past year. But even, when we spoke last week, you had mentioned a function in Excel that sounded quite sophisticated. So definitely, I think I'm gonna start there, getting my feet more wet with
Yeah.
that.
Definitely, I would suggest that before even
Mhm.
thinking about R and Python. Definitely get really comfortable with Excel, get really
Mhm.
comfortable with VLOOKUP. That is one function that's highly used in Excel. And number two, pivot tables. Get really
That
comfortable.
was the one you mentioned.
Yeah.
Yes, pivot tables.
Get really comfortable with pivot tables. So no, definitely that would be my recommendation. Definitely get really comfortable with Excel. Just apply it to your current work. There's got to be a use case that you can identify that you can apply it to.
Right.
Even your personal things like your finances. I do all my finances in Excel and pivot tables and just so by way of doing that, like as like if you have your infection control, right?
Correct.
In the nursing home. So if you have a specific project, it's like, okay, we have these data and we need to be able to view it in this way. How do I do this? Okay, and you just little by little teach yourself trial and error, and that's how you build your skill set. And I think that's the best way to do it. Yes, there are classes out there that can really help give you a jump start, but like the best school, the best teacher is experience and actually rolling up your sleeve, doing something, trying it out. If it doesn't work, go back to the drawing board and try again. But yeah, definitely an exciting time. So congratulations on the new job, by the
Thank
way.
you. Thank
Not
you.
job. I'm usually try to be careful calling it a job, but a role.
Right.
It's
Job
something.
sounds mundane, like, oh,
Yeah,
gotta do
job
a job.
sounds like
Yeah.
something you're just doing just to do it for a paycheck.
Right.
But we're getting into these positions and these roles because it's what we're passionate about. We're doing this for a reason, fulfilling. Would you say that in your career you feel like you're fulfilling your life's purpose?
Yes, definitely.
Okay.
Definitely.
And really able to lean into your passion. So that is what I'm all about. So, what do you think you need more support in? Like, if you are speaking to one of your mentors, like, what would you be looking for in terms of help for you for getting to your goals that you stated earlier within the next 5, 10 years? What's the best
Um,
support?
I would definitely say networking,
Mm-hmm.
because I have applied for like these entry level sort of data positions, and it seemed to be very competitive. I have not gotten a
Mm-hmm.
call. It seems to be difficult, to be honest. So I know I'm very entry level, I'm a novice. So, maybe I don't have enough data experience for them, which is
Uh-huh.
understandable, but it definitely seems to be kind of competitive as it's ramping up.
Yeah.
So yeah, networking, I would say for sure. While I work on the Excel, and get comfortable with that,
Mhm.
having people kind of speak on my behalf.
Yes, and be in your corner. And somebody once told me something kind of powerful, which I love. And she said, T, you got to understand, you got to have people who will speak on your behalf, even when you're not in the room. Also make sure your resume is, I believe it's ATS friendly. It's this AI tool, the
Oh yeah.
application tracking system, I believe it is.
And it's AI
It's
driven.
AI. Yeah, and it's
Mhm.
basically scouring, looking at your resume and seeing if you have the keywords that the employer is looking for in the first place. And if you don't, you're out already
Mhm.
before the employer even sees your resume because they get hundreds of entries. And it's
Right.
like, how are you going to stand out ahead of everybody? Number one, who you know. Number two, make sure that your resume is set up for that specific position. It's a lot of work. It's like you got to put on your project manager hat when you're going out there looking for a role because you take the actual job description, break it down to the keywords, exactly what the experience is, and making sure that your resume matches that. And there are actually some tools out there. I think JobScan is one of them. You can go on the website and you can pop in the job description and then pop in your resume, and it'll give you a percentage of how likely are you to get a call
Right.
for this job description. So just really leverage all the tools that you have at your disposal. But definitely, I'll say a thing about networking. There is power in networking, and there's power in connecting with others, and I mean, that's how you find some key mentors, and your clan, so to speak. One way to get that is getting really active with organizations or associations similar to uh, National Association of Health Services Executives,
Yes.
NASE, NASHE, um, also Healthcare Leaders of New York, or ACHE, American College of Healthcare Executives. And really grateful for all of them. And it really does. I know I sound like a cliche here, but it takes a village. Takes a village to really, you learn from everyone's experience.
A community,
It's a
essentially.
community. Yeah, you build the community and you tap into the community, and you also give back to the community. Do you have any specific success stories that you can share with us related to how you were able to see firsthand the power of data in healthcare? Any examples from your experiences over the years?
Um, I would say, well, at my current role as an infection preventionist,
Mm-hmm,
I do, I have to keep track of infections, various infections. UTIs is a big one, as you know, in the nursing home.
mm-hmm, mm-hmm,
Another big one is pneumonias. There's a lot of pneumonias.
mm-hmm,
We do offer a pneumonia vaccine that can not doesn't always prevent, but it all definitely can lessen the risk of serious complications like intubation or dying.
mm-hmm,
Receive the vaccine, but also I guess using Excel again, because that's really mostly what I use. I also use an app called My Ability, which keeps track of the infection rate, and you can upload that data from there to Excel. Um, so when I see the infections, what I usually do, especially with the pneumonias, because we have a lot of people who have feeding tubes,
mm-hmm,
gastric tubes, I'll go do a spot check. Like if I notice a lot of patients when feeding tubes that are getting pneumonias, it's likely because they're aspirating.
mm,
It's likely because they're, and 9 times out of 10, I'll go and I'll check on those residents or all the residents
mm-hmm,
on these feeding tubes, and they're laying almost 180 degrees flat, which is a big no-no because
mm.
that's what causes, the
Right.
context from the stomach gastric context to reflux and then go into the lungs, and then that can get very serious very
Yeah.
quickly. So I've noticed a decrease in the aspiration pneumonia specifically. Definitely have to in-service staff because a lot of them they don't realize
Mm-hmm,
you have to keep that head of the bed. They say 30 degrees, I say 40. Unless the patient's really adamant, some of them are alert and oriented. They
mm-hmm.
don't get
Interesting.
out of the bed elevated significantly. Um, so,
Yeah.
and that's something that I learned as a CNA on the oncology floor. We
Mm-hmm,
had a lot of esophageal cancers, stomach
mm-hmm,
cancers, and so, they would have feeding tubes either in the stomach or the duodenum, the
mm-hmm,
small intestine. Um, and we were taught, if you could lay them down. We in the hospital setting, we were allowed to pause the feeding, lay them down,
mm-hmm,
continence care, change them, and then bring them back up and restart the feeding. Even if we forgot to restart the feeding, if you forget, after a while it'll start beeping.
mm-hmm,
The nurses, they wouldn't get mad at that. We wouldn't get in trouble for that. Be like, oh, you just forgot to restart it. It's a much bigger deal if you restart it and
mm-hmm,
the patient is laying flat.
mm,
So, just keeping track of that data and, then doing the hands-on work with the staff and
mm-hmm.
servicing with the staff and saying, listen,
Yeah.
we got this issue. So, for patient safety and to
Yeah.
reduce the risk of, like pneumonia,
Yeah.
that's what we got to do.
No, I love that. And that adds the power in data is that it allows you to try and keep the pulse of what's happening. And I love how, like, you're keeping the track of the infections, and that, you're looking at a specific number, it's indicating that we need to take some kind of action. And your action is in services, right? Education. Usually more education. Well, first of all, awareness, right? And then like understanding where you should be in terms of this is the number of infections we should have, and we're actually here. Okay, we need to do something. And like if you do these, you ever do like a series of in-services and then track like where the infection rates are after the in-services are done
So,
so that you could see that it's, a direct impact?
so yes, that's an important element too. It's not just in service and done. You have to still keep track,
Mhm.
and
No, totally.
you see those
Mhm,
numbers trend down.
mhm.
Um, so yes, definitely.
Awesome. Yeah. All right. So, I just wanted to have you on the show and really talk about where you are in your career and really talk about where you'd like to go in your career. We covered that. And what would you say is your destination role? Like, where do you want to see
Like a
yourself?
dream role.
Yeah. Like, what's your dream role?
Definitely in informatics leadership,
Okay.
after getting comfortable in it, like I said, education that's the likely trajectory for me.
Hmm.
Um, whether it's the MPH with the informatics concentration or just the, MS in informatics. Um, learning those things, learning
Hmm.
the Excel, the SQL, the Python, and getting comfortable and working my way up for sure.
Hmm.
Informatics leadership.
Hmm.
When I was applying for jobs, the
Hmm.
competitive jobs that did not call me back, I noticed a lot of like, chief informatics officer and stuff
Hmm.
like that. I know, well, I'm in New York City, so I would see a couple, pretty powerful jobs at Sloan Kettering,
Hmm.
specifically, the going back to oncology,
Hmm.
a lot of advanced roles there, that
Okay.
sound interesting. So I'm
Yeah.
pretty open, but just working my way up.
Okay. No, that's exciting. I mean, and I like how when you said before, I'm a novice, but I like novices. I love when people are starting out or, closer to starting out because you're hungry.
Right.
You're fueled, you're fueled with, yeah, I may not have all of the experience, but I'm really excited to learn, to get in there, roll up the sleeves and get busy. So yeah, no, it's a pretty exciting place to be. So I wish you all the luck. I mean, if there's anything I can do ever to help you out, please let me know. Look at my LinkedIn profile. If there's anybody out there you'd like to be connected with, let me know. And if folks want to reach out to you, are you okay with that? And if yes, how can they do that? What's the best way to get in contact with you?
So I am on LinkedIn. So it's just my name, Kimberly Leak BSN RN. I
Mhm.
think if they type in, and I'm in the New York City area. So
All right. All right. So I think thank you so much for coming on the show. We are coming to the end. Just wanted to have a brief chat with you. And like, I get excited when I talk to folks who are really stepping into, this path and like really leaning into working with data and informatics, just the whole world of data and really leveraging data in healthcare. Because I've seen it time and time again where you really lean into healthcare and the data and it improves lives, and you can see the impact directly. So thank you for what you do, and I wish you all the luck.